This past summer, I was having a problem with my hearing. I had more hearing loss in one ear than the other, and I went in to get it checked out. The doctor recommended I get an MRI because there was a possibility of a brain tumor. I had the MRI. There was indeed a tumor, what he thought was likely a benign tumor, but nonetheless a little scary, and he referred me to a surgeon, Dr. Waziri.
In Bob's case, there were a couple of things about the appearance of his tumor and the interaction of the tumor with the surrounding brain that made us a little bit worried at the time it might be a more aggressive lesion. I think one of the challenges for Bob, and this is something I spent a lot of time talking with he and his wife the first day we met each other, was he went from having some mild hearing loss to having a spot on the scan to hearing that he has a tumor that now needs to be removed and may have some aggressive features that would require some further therapy. That's a life-altering event.
You know, when he told me that surgery was likely an option, I started to get a little upset, and he put his hand on my shoulder and he said, "Look, we're going to get you through this, Bob." And I was I felt like I was talking to a human being, not just another doctor. And another part of it that was important to me was that Dr. Waziri was at Inova Fairfax Hospital.
You can't do these surgeries in small community-based hospitals. One of the things that brought me to Inova is that there really wasn't another brain tumor program in the city at the time. And so people are having to leave Washington, D.C. and Northern Virginia to try to find therapy for these otherwise very aggressive and difficult to treat tumors. My goal is to create a center here that will provide every and all therapeutic option all the way to the end of the research spectrum, providing them options, giving them therapies that they may not have access to at other places. That's a huge part of what motivates me on a day-to-day basis.
We live in an important place. We live in the nation's capital here in Washington, D.C., and there's no reason why someone should have to go outside this area to get the best health care available and to get the best surgeons available. And that's what Inova Fairfax and doctors like Alan Waziri are bringing here.
I'm a clinician scientist, and what that means is that I take care of patients, but at the same time I am pursuing research, potentially even basic laboratory-based at-the-bench research to try to develop new therapies. The advantage that I have is that I can move between those two arenas and I see where their need is.
My wife and I decided we wanted to make a multi-year commitment of support, a larger commitment of support than we've probably made for anything else of a charitable nature.
Philanthropy is a critical part of research, funding clinical trials that aren't fundable through traditional mechanisms that may provide enormous advances in how we manage patients with tumors, and brain tumors in particular. Without that support, we really can't continue to grow and move forward.
It is true. It's better to give than receive. It makes you feel really good to give back.
If someone donates to my lab, that is an immediate statement of confidence and belief that what we're doing is important and valuable. And I take that very, very seriously, and it's a humbling experience.
To Dr. Waziri and everyone at Inova Fairfax who took care of me, took care of my family, I am eternally grateful. And there's not a day that goes by that I don't think of the work that was done here to help me so I could get back to my normal, everyday life.
There is no better cause to support than research focusing on developing better and more patient-specific therapies for cancer. This is something that will affect everybody in their lives at some point.